Hello, everyone. Welcome to the Komen Breast Cancer Education Series. I am so glad you can join us today for today's roundtable discussion about a critical issue in women's health, and especially in breast cancer care, the pursuit of racial equity in screening, treatment, and survival. Today's program is presented by Independence Blue Cross. We are proud to support Susan G. Komen, whose advocacy for all women has helped save countless lives. And in particular, we're excited to be a part of today's discussion because health equity is at the top of the list of our strategic and moral priorities as a company. My name is Dr. Shawn Ross. My clinical background is as a registered nurse and family nurse practitioner, and I've spent the majority of my career as a hospital administrator. I joined Independence Blue Cross last year as the company's first executive director of health equity, and my job is to develop and implement strategies across Independence that ensure equitable whole person health for our members we serve and the communities where they live. Independence is also part of Accelerate Health Equity, which is a collaborative with all of the other major health systems and other key players in Philadelphia to test and scale interventions that reduce disparities in care. And with other Blue plans across America, our work encompasses the Blue Cross Blue Shield National Health Equity Strategy, which includes a number of conditions that affect women at disproportionate rates. So today's discussion is dear to my heart, and I am happy now to introduce our very accomplished panelists. First, we have Dr. Tara-Lynn Carter of MD Anderson Cancer Center at Cooper. Dr. Carter is a breast surgeon oncologist and also an assistant professor of surgery at Cooper Medical School at Rowan University. In addition to practicing surgery, she oversees high quality care to patients with breast cancer. She has made many presentations associated with cancer care and serves on hospital and community committees, including Komen's Leadership Council. We also welcome Dr. Elena Mateo of Penn Medicine. She's a surgical oncologist specializing in breast cancer surgery and benign and malignant diseases of the breast. She also directs integrated breast cancer care at Pennsylvania Hospital. Dr. Mateo is passionate about addressing the disproportionate impact on women of color, and much of her practice focuses on outreach to Spanish-speaking communities. Finally, we have Natasha Mayjay. She is the Director of Community Health and Outreach for Susan G. Komen. Natasha is a public health practitioner with more than 15 years of experience, and she's been with Susan G. Komen for 4 years, always focused on addressing health inequities. And prior to her work at Komen, Natasha was a public health practitioner at major universities in Los Angeles and Chicago. So now their bios are out of the way, let's start our discussion on the inequities that exist in breast cancer care and Susan G. Komen's plan for a health equity revolution. So Natasha, I'll start with you, although I leave the floor open for all to add to the conversation wherever you see fit. I want our audience to know more about Susan G. Komen's Stand for Her program. So what is Stand for Her, and how did you identify Greater Philadelphia as one of the 10 cities to target?
Sure. And thank you for having me. So what I'd like to do before we talk about what Stand for Her is right now, I'd like to give a little bit of a history about how this came to be. So some years back, Susan G. Komen launched the African American Health Equity Initiative, and its goal was closing that breast cancer mortality gap, beginning with 10 metropolitan areas where those health disparities or breast cancer disparities were the greatest. Unfortunately, Philadelphia is one of the areas that's on that list. So through this initiative, Komen sought to, first, we wanted to listen. We wanted to, we had different roundtables in those 10 different areas to better understand what was going on behind the data that we were already seeing. We really wanted to get real stories and conversations to understand what was going on. And then we learned. We conducted an in-depth 2-year review of relevant health-related information, policies, data, and then we also did a lot of qualitative data collection by way of focus groups and interviews to make recommendations. And with Stand for Her, that's the way we are taking action. So with the learnings from the landscape analyses in those areas, and the roadmap, we've launched Stand for Her, which is a series of focused interventions in each of those 10 metropolitan areas to address the inequities.
Thanks for that, Natasha. Could you tell us what those interventions are? Because Black women are dying at disproportionate rates from breast cancer. They aren't diagnosed as often as white women, but they're dying more than white women. What are the interventions that Stand for Her? What are they incorporating to sort of mitigate that?
Absolutely, and you're spot on with that. In Philadelphia, in particular, we know that screening rates. So for screening mammograms, those rates are pretty high for Black women, but we know that Black women are still dying at high rates. And so, what is going on? Some of the ways that we are addressing that is through a series of interventions. And one of the ways we're doing that is through patient navigation. We know that with patient navigation, folks may be able to get more easily connected to the resources that are available to them, and then also be able to deal with the racism that exists in our healthcare systems. And so with patient navigation, it's a two-pronged approach. First, we actually have a patient navigation program through Komen. So we are providing that culturally competent patient navigation service that empowers patients and connects them to needed care in their communities. And then we are also cultivating a national network of Black patient navigators through our Navigation Nation, which is a training on core competencies on how to navigate racism and implicit bias in the healthcare system, and then support the patients through that system. The other, another intervention that we have is our patient care center, and it consists of our breast care helpline, which provides trustworthy psychosocial information and emotional support. And then also our financial assistance program, which provides funding for those who are in treatment who need a little extra funding. There is additional funding there also for people who are either in treatment for metastatic breast cancer or living with metastatic breast cancer. And then we have a screening and diagnostics program. And one of the things that we found from the landscape analysis was that access to screening, and for Philadelphia, what we noticed was access to diagnostic services was really important. And so I am proud to say that we've partnered with Penn Medicine to be able to offer screening and diagnostics in the local area. Lastly is genetic counseling and testing. So we noticed that there are some inequities with regard to access to genetic counseling and testing. And so one of the things we are offering, along with partnering with Penn Med again, and we're excited to do that, is offering genetic counseling and testing for Black families in the Philadelphia area. So we are really looking forward and excited about that partnership.
That is awesome. Thank you. So I guess it's a good time to pivot to our two physicians and ask about their experience. What strategies have you guys utilized in your practice and within the healthcare systems that you work in to promote health equity? And I'm going to start with Dr. Carter, and then Dr. Mateo, please jump in.
Here at Cooper, our healthcare system is very focused on making sure that we are doing everything we can for every patient. And we identify that there are patients that obviously don't do as well. We know from the statistics that though Black women are diagnosed less often than white women, that they're more likely to succumb to their disease. We also know that our Hispanic population is diagnosed at a more advanced stage than our white female population. And so we take a lot of time to look into that. So we have a lot of research going on looking at our populations, the patients that we see, to make sure that everyone is getting the same care from our system. And we evaluate kind of on a rolling basis yearly to make sure that our times to diagnosis are appropriate. So from the time that you get your imaging to the time that you first get treatment, is everybody getting the same thing, or are we delaying for someone? And if we are delaying for someone, why are we doing it? So we also have a lot of community resources available to make sure that patients can make it to their appointments, because that's one of the things when we look at like socioeconomic factors. How do you get to your appointments? What's your support system? We have support groups to make sure that our patients are getting the help that they need to make it through their treatment. And on a personal level, I just need to make sure that I'm taking care of every patient as an individual to make sure that they can get through their treatment. So personalized care is very important to me here at Cooper.
Awesome. Dr. Mateo, what strategies have you utilized in your practice to promote health equity?
So most importantly for me, coming from a Spanish background, I understand the importance of having a physician who looks like you, speaks your language. So I approach my patients much in the same way that I do my own family. So like we've all stated, data shows that there is a disproportionate amount of advanced breast cancer in women of color. So knowing that, I make it a personal mission to have a specific focus in reaching these women and to detect cancer earlier and have improved outcomes. So specifically at Penn Medicine, there's a couple of programs that advance health equity and care in cancer care, including the free mammogram screenings that we talked about, which are largely funded thanks to a Komen grant, and they focus both on Black and Hispanic women. The Vassar Center at the University of Pennsylvania is focused on genetically inherited breast cancers, and there is a major initiative that focuses on genetic testing and genetic counseling for women of color. Also, several times a year, Penn Medicine's outreach team does head up community clinics across Philadelphia. Specifically for my practice, we bring mobile mammography to several communities in support of these events. So we all know that transportation and access to screening services are significant barriers. So actually bringing these mobile mammograms to these historically disadvantaged communities really is helping to bridge those gaps. We know there's a lot more work to be done to bring down these barriers, and I'm always, and I know we're always welcome with any input and community partnerships.
That's wonderful. Dr. Carter, as Dr. Mateo mentioned, some of the strategies that they use, you mentioned provider-patient concordance. Are there obstacles, any common obstacles that your patients face? I know you mentioned transportation, that you guys provide transportation, but are there any others that your patients face through diagnosis and treatment that you are helping them overcome?
I agree with Dr. Mateo. There's a lot that, as you mentioned, lands on when patients see providers that look like them. They have a comfort level that this person is going to take care of me. The healthcare system has not been historically friendly to patients of color. And a lot of our patients come in, with the thought that the same thing is going to happen to them that happened to someone else they know, or to some other story that they've heard. So being able to make sure that patients get their preference of provider is one thing that we do. When we talk about people not having the resources to make it to get screening, to pay for their diagnostics, whatever that is, we do have the New Jersey SEED program here at Cooper, which is a program that allows for these patients to get their diagnostics, to get their biopsies, and is supported by the state to make sure that they're not falling through the cracks. And the majority of those patients, I would say, are patients of color, to make sure that we're getting there. I talked about our transportation assistance. We have a lot of sort of supportive, assistive services to make sure that our patients aren't getting lost. We also have patient navigation when our patients are diagnosed with breast cancer, and our navigators are all over making sure that they're talking to our patients on a regular basis to make sure that they know what's going on, that we can get them to their appointments, and that they will get there. I see a lot of patients who come in and frankly, they're just scared.
Yeah.
And I tell them,
Yeah.
if you weren't scared, I might be a little bit concerned about you because we see this every day. This is my job. I'm supposed to take care of you. So I'm not scared when I see you, but this should not be a thing that you are seeing every day in your life. This is, we need to get you through this period and then get you onto survivorship. And if starting this process isn't just a little bit scary, I mean, I wish I had the same thing that you had that made it not scary, but alas, this is what I expect when you come in, and to make sure that our patients know that the support is there for them within our system from all angles.
That's wonderful. Dr. Mateo, you mentioned that there is a certain level of comfort, right? Sort of what Dr. Carter was just speaking to, that there's a certain level of comfort when your provider looks like you, right? But as we see these, and honestly, as a woman of color yourself, you get it. How does that translate, right? When you are taking care of a Black woman, how does that, what has your department done to make them feel comfortable, particularly given the fact that they're dying at higher rates?
Yeah, I think that initial visit with the physician is so important.
Yeah.
That's that first welcoming. It's the first time that, a lot of times, it's the first time you're actually telling them you have cancer.
Yeah.
You know, they are referred to your office and they really don't know, or maybe someone told them and it just never really, you know, it never really settled that they had cancer. So that first appointment is so important. And it's about establishing trust, establishing, you know, showing that you care, and really teaching them a new language that they're going to learn for the next several years while they're with you. And it's, you know, there's, like we talked about, lots of barriers and lots of challenges when speaking with women of color. Also, there is, you know, I think that upfront, the awareness of just the importance of cancer screening is a challenge. You know, for patients that are underinsured, they don't have a primary care doctor, and that's recently, you know, usually they're your gynecologists, your PCPs, your gateway to getting mammograms. They're the ones that are supposed to stress the factor that, you know, at 40, you're 40, time to get your mammogram. So because of this, many of the women that I see are diagnosed at later stages, at the point that they're showing symptoms. So they're showing a breast mass, they're showing skin changes, rather than breast cancer being detected months, if not years earlier, at the point that you're getting screening. And then also, you know, the fact that it's nice to have somebody that you have common ground with. There's lots of cultural barriers. You know, to discussing breast cancer. It's taboo. It's, you know, you don't want to talk about your great grandmother, your mother with cancer. You know, it's not a nice subject to talk about, but I think that it's something that should be done. And it's not frequently, you know, talked openly in families. And, you know, I think it's good to normalize it and normalize the fact that this is for all of us. This is for our children, you know, the importance of genetic testing. And so that conversation is just not had in certain communities. And I think as a result, you know, you do see these disparities. So I think that the cultural aspect has some barrier, has something to do with it too. And then, you know, other things that I thought, you know, I thought about transportation. I know we missed it, but also like childcare. There's family emergencies. There's work schedules. You know, I can't get my mammogram because I have to work from 8 to 6, and that's the way my shift is, and I need that. So there is, you know, so we screen them, but, you know, often after you get your screening mammogram, you find something, you have to come back for a diagnostic. So that follow up is really hard to do. You can't tell your boss that you are taking 3 days off this week, you know? So I think that for some, you know, and there's a privilege there for some women who have the ability to say, I have to go to my doctor's appointment. Well, there's people that work that they're like, I'm sorry, you can't, I need somebody to cover your shift, right? So, so, you know, I think understanding that that is really a barrier is important. And really, when you're with the patient in the room, understanding how hard it was for them to get there and how hard it will be for them to do the next couple appointments that you set them up for.
Yeah, that's great. I think that it's really important, right, for people to feel as if their healthcare providers actually care enough to think about these things and offer them solutions before they actually even arise.
Right.
Natasha, we have heard from Dr. Carter and Dr. Mateo about things that they're doing on a system level, a health system level, on a community level. Even as we discuss Stand for Her, are there things that on a community level Susan G. Komen is doing to sort of bolster and assist with what the healthcare systems are doing?
Yeah, absolutely. And as both Dr. Mateo and Dr. Carter were talking, I'm shaking my head because you all have the real life experience of working with patients and experiencing some of these things. And our data from the landscape analysis showed the same thing, that fear was a huge issue for people. And it kind of led to people not being screened regularly. And we know that not only are mortality rates higher for women of color, but also late stage diagnoses. And we know that without regular screening, if we do find cancer, a lot of times for women of color, it tends to be a later stage. And so addressing those kinds of things are really important. One of the pieces that we're doing around this is education. We think education, helping people become aware of all of this information, just the access and letting folks know through the patient navigators, our patient navigators, and then also working with other patient navigators who are on the ground to know where screening sites might be. That was another thing that came up in the landscape analysis. Even though it's readily available, sometimes people don't know how to access it or where it may be located. So just keeping people up to date on those things. But then also to Dr. Mateo's point of the other things that come up for folks, when times are tough and you want to get screening, making sure that the providers understand what that looks like, understand childcare issues, understand all of that. And it all circles back to having providers who sort of look like you and understanding that shared and lived experience. That's so important. Yeah.
I think that, Natasha, what you mentioned is so important, right? Educating people to empower their agency. Like, part of it is people of color don't trust the healthcare system as it is. Not only do they not trust it, they know, because they don't trust it, they don't know what to do when they are forced to be in it. And so, from a community standpoint, that is the things that Susan G. Komen is doing in terms of education is important. I'm going to pose this question to both Dr. Carter and Dr. Mateo. How does your organizations or you personally in your practice assist patients in empowering them to ask the right questions so that they know what is needed for their care?
Personally, I obviously want to convey to them, what cancer they have, what stage they have, and if they have options of, whether to do a lumpectomy or mastectomy, I want to empower them with that decision. So give them all the information up front and say that I want you to make it, as best of a joint decision, and I can help them with that. In terms of their care, because cancer care nowadays, especially breast cancer, is so individualized. And to touch on the point about just having this distrust, I mean, it's true. A lot of the data that we have with breast cancer are gotten from clinical trials that were all white women that were registered. So, something that we can do as practitioners is encourage our women of color to do a clinical trial, to be involved, and to tell them what that's like. It's not different than the standard of care. Going on a clinical trial is just to see if, testing out a new medication, testing out a new strategy, but it's not going to be different than the standard of care. And that way, when, in the future, we say this drug works, we can say, well, who was in that study? Well, there's, 40% women of color were in that study. And I think that really builds trust to know that that we care and that we really study, all populations and not just focus on white women or white men, et cetera.
Right. I think that goes sort of to the point that we're making, that there is a distrust because a valid distrust in the healthcare
Right.
system, particularly because of all of the things that were done without our consent.
Absolutely. Yeah.
And the more we have providers who are of color, who are suggesting or encouraging these things, I think there's a certain level of trust there. But the more that we do, the more that we encourage participation, I think we will build trust. Dr. Carter, same question to you.
Yeah, I think additionally, some of the things that my patients come in concerned about are things that they've seen on the internet.
Yeah.
And so Dr. Google is
it's a real thing.
And everyone has access to Dr. Google. And there are some patients who don't want to look at anything before they come in, and that tends to actually be a little bit easier than the patients who are looking at everything before they come in. And so part of what I personally feel the need to do to try and help my patients is make sure to direct them to reputable information on the internet, because chances are I'm not going to be able to keep them off the internet, nor do I want them to think that everything I say is the gospel and they have no other options to look at. And that goes back to what Dr. Mateo said about shared decision making. There are decisions to be made by the patient. And I don't think that if I try to make them for them, that helps the trust relationship between the physician and the patient. And that has never been my thought when I decided to go into medicine, and when I decided that I was going to be a breast surgeon. At no point in my training, in my practice, have I ever thought that I should be the decision maker for everything that happens with my patients. And a lot of patients, that has been the way that they've experienced medicine. Whoever their provider is the decision maker. And it's important for building trust to let the patient know that they really do have a say. So here are the options for you. Let me lay them all out. And let's talk about what's going to make you most comfortable with what happens in your treatment. Now, some of these options are, you're going to have to do a surgery. Let's pick the right one, right? I'm not saying let's decide we're not going to have treatment. That's, totally down a different road. But what I'm saying is, this needs to be done. Let's pick which way we do this that makes you more comfortable. And that helps build trust. This needs to be done. You read this on the internet about it. How about I direct you to the Komen website where you can get set up with a navigator who can help you sift through this information if you're not comfortable talking to me about it. Then you can come back to me and we can talk about what your choice is going to be. So making sure that I'm directing the patients to the right places to get the reputable information, as opposed to who knows what else they might be seeing in Dr. Google, is also what I feel, very important to building trust. And I've had a lot of patients that say, oh yeah, I'm glad we talked about this, because I was pretty scared about this one thing when I read it on the internet. But now that I know that this is, the perspective, and this is why that person said that, and this is why it works, that helps a lot.
Yeah, and also like putting the choice on them, putting that decision, like you bring them to like a point, and you say, okay, I brought you this far, now you can choose this or this. It really puts the control back on their hands, and that builds trust, but also compliance of treatment.
Definitely.
If we say that we recommend you being on this pill for 5 years to decrease your risk of cancer, but hey, it has 5 side effects, I think you're going to get a little bit more compliance with medication and compliance with treatment if they feel like they're part of the decision making and they actually elect to do a lot of these things, as opposed to this outdated kind of paternalistic style medicine that was
hit the nail
a
on the
long time
head.
ago.
Yes.
Yeah, to add to that, I think how wonderful that that's coming from the two of you as medical providers. I think that is empowering in and of itself, saying, hey, I'm the expert here, but I don't make all the decisions. That the decision to make these choices is up to you. I'm going to give you my best feedback, but you should feel empowered as a patient to make those choices, or go and seek more information and then come back and tell me what the decision is. I think that is so powerful. And I do think that's kind of meeting the patients where they are, and it's sort of what they need when they come into that space. Dr. Carter, you mentioned the patient navigation role again. And I think that that is wonderful on the front end and all throughout the process. And, you know, very important. I know my mom, I had to pep talk her. She's a 7-year survivor. And I said, hey, when you go in there, know that you have some decision making. Like you have the power to make decisions. It is not a yes, yes, okay. Ask your questions, you know, so that's important.
Yeah, I think it's important, right? And I think it's a great practice that clinicians utilize. Hopefully, all are utilizing that to engage the patient, because to everyone's point, if the patient is not engaged in the treatment, it is a high likely of treatment failure, and which has negative sequelae for the patient and for their families. Natasha, as we talk about this, as we talk about these navigators, how does someone enroll, or what do they need to do to get in the Stand for Her program?
Sure, there's a few entry points. And so if someone is just interested in getting information, generalized information, or learning where to start, the breast care helpline is a really great option. So they could call 1-877-GO-KOMEN or email helpline@komen.org. If someone is interested in the Navigation Nation training, they could email navigationnation@komen.org. So I would say those are the two best entry points. And then if they have additional questions, they can get them connected within Komen.
Awesome. Thank you. So this has been a great discussion. I think that the folks who are listening will, one, have agency, understand that they have agency too. They have some great clinicians in this region that they can connect with if they unfortunately have this diagnosis. And then 3, they know how to connect with the Stand for Her program. So I want to give each of you final thoughts, or a couple minutes to give your final thoughts, and I'll start with Dr. Mateo.
I would say I would love to empower women, specifically women of color, to first go and get their mammograms, but, you know, really take charge of this diagnosis, take charge of your care, be actively involved. Ask for help if you have trouble with transportation, if you have trouble getting to an appointment, ask for help. There's navigators, there are social workers in the system that can really help with you. So my goal is to really close this gap, close this disparity, because it's 2022. We need to really make sure that we're giving exceptional care to all women, and everybody has access to the great care that we have in the city.
Thank you. Dr. Carter?
I would just say that this journey with breast cancer is a journey from the point of screening until you finish treatment, and there are people to help at every level of that. We don't just meet you after your diagnosis. There are a lot of patients that we meet when they're kind of in the process before they get their diagnostic imaging. And it's education for patients that we need to get out there and make sure that again, that you have the opportunity to make choices and be involved in your care. It's education for other healthcare providers who are in other areas that are the start points for patients, that we like to make sure that we are working with their primary cares and their gynecologists. But also, just at a deeper personal level, women of color spend a lot of time taking care of everyone around them and don't always stop to take care of themselves. And you cannot help your community if you don't help yourself. And so just to make sure that our patients and our communities and our women know that it's okay to take a little time to take care of yourself so that we can get you back to all the things that you do for everyone else in your life, because no one can depend on you if you're not well. And that's the whole point of your treatment, to get you well so that you can do the things that you want to do with your life.
So well said, Dr. Carter. We are the bedrock of our community, and if we go down, then the whole community goes down. Natasha, final thoughts?
Sure. I would say remain vigilant on many different levels. And so part of that is about knowing your history, your family history. And by knowing your family history, you end up knowing your risk. And then you can do something about it. I would also say know your body, being vigilant about that. It doesn't matter how old you are, breast problems, breast cancer can show up at any age. And I know we're told age 40, but that is not true. Especially for women of color, we get diagnosed with more aggressive breast cancers at earlier years. So if you know that there's a problem, don't take no for an answer. Just keep asking, keep checking in with your medical providers and say, no, I need to get this checked out. Remain vigilant.
Wonderful advice. And with that, I want to thank my esteemed panelists for participating today, as well as Susan G. Komen. Again, I am Sean Ross, and it's been a privilege to be a part of this conversation. And to everyone listening, be well and take care. Thank you.